Thank you so much, Dr. Sparks, and thank you to the Purina Institute for inviting me here today. I definitely concur. This has been a fantastic event. I have learned quite a bit, and I'm really excited to be here today and to talk about FLUTD. And, you know, I might be a little bit biased, but I think the bladder is the most fascinating organ in the body, all right? Now, granted, it can have changes too, that it will respond to other abnormalities that are occurring in the body. So that too makes it super, super fascinating. Here's my disclosure slide. And this is how my brain felt when they asked me to speak on this in 50 minutes. It was completely jumbled. I thought, okay, where do I start? And so my brain immediately went to FIC, right? Feline idiopathic cystitis. And for those of us who are old enough, and that's been said a lot in this room, I think, over the past 2 days, and the worst part is I've raised my hand then every single time, because that's been me. But we might have heard this disease be, you know, FUS, or of course the human counterpart, which is interstitial cystitis, and the numerous acronyms too that are related to that. But of course we all know that cats that present with lower urinary tract signs can also be diagnosed like with bacterial cystitis, urolithiasis, even neoplasia. And to make matters worse, if you want to say worse, but we all know the acronyms and names are confusing. Well, this was just brought to my attention recently. They're actually thinking too of renaming FIC. And I think, you know, the sentiment behind it, I wasn't privy to these conversations, was because they want to maybe take a name that might reflect a little bit more on the disease process. I found that really interesting too, because we've had some talks on communication. And what I like to do in this disease is to talk to my clients and give them enough of the pathophysiology where they feel empowered, they understand the disease, so then together when you design a management strategy, they are much more likely to hopefully implement those changes and you might have a more successful outcome. All right, so what am I talking about? I will present a few papers and topics on FLUTD. Some studies actually went ahead, particularly ones on risk factors, and looked at cats with FIC, stones, and usually bacterial cystitis. And I think that's okay to do, particularly because some of the risk factors are the same across the board, which is helpful then. I'll spend probably the first half talking about FIC. And I have to give a big shout out to my mentor, Dr. Tony Buffington. I think we all know that he has certainly, you know, changed the way we approach this disease and of course our management. And he is still actively engaged in the research even though he's now retired. I've also taken a few of his slides from a previous presentation and I'll point that out. During the second half, I'll talk about urolithiasis, primarily focused on calcium oxalate. And I chose these two because really the pathogenesis is unknown. And also I think what's most fascinating is these can serve as naturally occurring models for their human counterpart. So we get that really great One Health approach to medicine. And I think some of you who know me too, I always like to say, you know, humans serve as a wonderful model for our patients. And that helps us a lot more, I think, progress our field. So looking at FLUTD in general too, the other reason I wanted to talk about it is, I mean, there is a worldwide prevalence of this disease, right? And in particular, looking, say, at FIC, we can deal with pretty severe recurrent cases. Up to 15% in some studies have been found to be persistent. And that's tough and can lead even to relinquishment and euthanasia. I'm not going to spend much time on the blocked cat, but clearly I know we all struggle with immediate urethral obstructions even in the hospital, and then of course even within 30 to 60 days after discharge. Recurrence rates for urolithiasis are anywhere from 5 to maybe up to 40%. That'll depend too on how you document recurrence, right? Is it clinical or radiographic? And then also it's variable by stone type. I pulled these two papers too because I think they're quite interesting, looking at considerations for recurrent lower urinary tract signs. The paper that you see on your right looked at about 246 cats, and what they did is they tried to follow up some of them that had recurrence, say, 2 months after their first diagnosis. Now, 2 of those cats that initially had stones ended up presenting with FIC, and 4 cats with FIC came back with urolithiasis or bacterial cystitis. Similar type of scenario with the other study posted there. Cats who had recurrence, about 14 of them had different diagnoses on their recurrent episodes. That is different than what happens in humans. But what I have started to wonder is, yes, I still need to consider doing diagnostic workup when the cats present a second and third time. But I also want to consider, could it possibly be that whatever is happening systemically, maybe it's the change in their environment, their diet, their microbiome, might just be influencing the bladder slightly differently and resulting in maybe a manifestation over time of different presentations. So looking at specific risk factors for FIC, it can vary based on the location. So FIC it is a worldwide disease, and the risk factors can be, certainly one that's looked at a lot is litter. And it has been shown that there's maybe about a 1.5 increased risk for cats who have the non-clumping litter compared to those who had the clumping litter. Litter box size and number can be a risk factor. That cat trying to squeeze its little bum in that tiny pan, that is not an optimal pottying environment for that cat. It's going to stress it out, right? So that's something that we have to all look at, and lots of clients are very well educated on this by now. Dry food, in numerous studies, if cats eating solely dry food is considered a risk factor. And if you see those 2 cats on the lounge chair then, some people are like, oh, aren't they cute lying out together? Look at their ears. Look at what they're like. Yeah, these 2 hate each other. And I know that because they're my cats. And I mean, yeah, they're outside. This is California sunshine, by the way, too. And they still were like, my area, your area. Now, I don't think either of my cats were genetically or whatever predisposed to lower urinary signs, so we just had to deal with other issues with them. The other thing that comes out a lot then, as I mentioned here, is conflict. And so whether it's in the same household or you have a cat maybe that's inside, but a cat that's outside in its territory. And some cats might find that offensive, and that type of stress can exacerbate the signs. And if you ever need pictures of cat conflict, just Google Jedi cat. You get lots of cat sword fighting, and it gives the illustration of what you mean. Other risk factors for FIC, we've talked about it a lot yesterday, obesity. It is a common problem in cat, right? Up to about 40% of cats are thought to be obese. And there have been associations between obesity and lower urinary tract disease. And I think we also know, too, how many of you all get those blocked cats that come in? How many of them are skinny? Yet most are really overweight, and it's really hard to catheterize them and deal with those. In this study by Cameron et al. That's depicted in the middle, they looked at 31 FIC cats and 24 controls. They found that being purebred or long-haired was a risk factor. Perhaps that suggests maybe a heritable or genetic predisposition. Most were middle-aged, and again, being overweight was considered a FIC risk factor. Now, another big thing to consider in our FIC cats is the lack of environmental enrichment. And we had a great talk by Dr. Delgado yesterday, and we'll hear more about the environment next. I'm not going to talk much about this, but I think we know that for some cats in particular, if they do not have an enriched environment, they're going to have a lot of problems with lower urinary tract signs. Cats might need access to the outdoors if it's feasible in your area. I know Dr. Delgado mentioned cats like to have a vantage point, right? They feel safer when they're above, and they can look down, if you will, on their prey and feel okay. And they need active areas to actually hide and have their own solitary moments. So I have a tendency to get good environmental questionnaires on all my cats that come in with lower urinary tract disease. How do we diagnose FIC? Well, it's currently still a diagnosis of exclusion. And to be quite honest, at this point, I'm okay with that. It's not that hard. You do a urine culture and you get a radiograph, and you've been able to rule out the other most common reasons for it. But there are a lot of diagnostics looking at biomarkers. And certainly they're non-invasive and they can be useful. I've just posted a few of them here. In one study, they looked at trefoil factor 2 that was found to be decreased in FIC cats. That can be needed for, say, urothelial repair. Fibronectin was found to be increased, and that can be increased usually due to increased bladder permeability. And we've certainly shown too in other studies using fluorescein dye that cats with FIC have highly permeable bladders. The thing with that, though, is some of those cats in those studies were also blocked. So it's hard to know if some of those changes were just the result of having a chronic distended bladder. Dr. Kruger and his group did some work looking at serum cytokines and chemokines in cats, and he found that in 13 healthy cats compared to 12 non-obstructive FIC cats, that some of the pro-inflammatory cytokines like IL-12 and IL-18 were significantly elevated. And also the last one that's listed there was also increased, and that might have resulted due to the actual disease process and it's being recruited because that might help protect and it's anti-inflammatory. Now, I think sometimes looking at serum cytokines could be really interesting because, as you know, FIC has two forms similar to IC. The most common form we all see are the cats that present with the chronic insidious lower urinary tract signs, versus the other type that's much more inflammatory, cats that have what are called Hunter's ulcers. I find my personal experience is very minimal, they're not very common, and those cats have a tendency to have much more hematuria and be more inflammatory. And I wonder too if maybe looking at some of these profiles and the cytokines, might that help us tease those two groups out? So I think that's a little area we could investigate further, because I think the treatment for some of those more inflammatory cases might alter just a little bit. Finally, the last biomarker I have up there is a candidate serum biomarker that Dr. Buffington and his group looked at. And what they found in cats with FIC and humans with IC, there were altered tryptophan and metabolites present. And it could readily discriminate the cases from the controls. And this pathway can be involved in a variety of altered mood states. And what's really interesting is that pathway is also found to be abnormal in, say, people with chronic fatigue syndrome, and that's a common comorbidity seen in humans with IC. So in humans, there are there's dozens and dozens and dozens of papers on biomarkers. And I think initially it was done because they were trying to differentiate overactive bladder from BPS-IC. Now, overactive bladder is primarily just characterized by an increased urgency to void. Both IC and FIC, though, are characterized a lot by pain. OAB will not be painful. So I personally think that the biomarkers aren't necessary, again, for a diagnosis. But what we could use biomarkers for might be, I agree with what was said in the previous talk earlier this morning on the approach to biomarkers. If we could find something that's really early and then intervene, that would be fantastic. Or I think it might help us a little bit in the pathophysiology. And looking at the fact, if you look at the disease process from a top-down approach or a bottom-up approach. And what do I mean by that? Well, what changes, say, happen if you have a top-down and the brain is sitting here thinking, I've got conflict going on, there's a change in my environment, what diet am I eating, how is that affecting my microbiome? The brain's processing a lot of this, the gut's processing it, and in some cats, it's manifesting as lower urinary signs, okay? And you might see changes in markers from that. But we also have to look then at the bottom-up approach, which most people have. Say if the bladder is injured, maybe there's a mild infection or a stone, and I'll briefly mention things about the urinary microbiome. Maybe that's altered. And the cats have inflammation or pain. It's going to get transmitted up the cord, right, into the higher centers. The brain's going to process it, and just imagine how wound up those cats can get from chronic pain in their pelvic area. All right, let's start a little bit from the bottom-up approach then. Lots and lots of studies have been done on bladder abnormalities in cats and humans. We did some, again, making sure these cats did not have OAB or overactive bladder. And that strip you see up there is a cystometrogram in a cat. So what we did is we had a catheter in the cat's bladder, and we're slowly distending it with saline. That flat area that you see, that's the relaxation compliance phase, so you're not going to get a big change in pressure with change in volume. Or else all of you drinking your water there, you'd be out to the bathroom every 3 minutes. So your bladder is really accommodating. Until at some point those muscarinic receptors will get triggered, the bladder's going to contract and you'll void. In overactive bladder, you might see spikes, say, at the very beginning of that strip, which we did not find in cats with FIC. But what we did find, and these cats were not clinical at the time we did these studies, and yet we still found the amount of saline we could put in was much less. The threshold pressure was a lot higher than healthy cats, which resulted in a much lower compliance. So they voided at lower volumes. And what's been shown too in cats, and kind of my feeling about this, is that maybe it's because their C fibers, which are unmyelinated pain sensory fibers, they're larger and they're more activated. And this could be a phenomenon that might be just related solely to pain, right? They just having that urgency to void because of the pain that they have associated in this disease. Looking a little bit more at the urothelial changes, the top kind of cartoon is a schematic of the bladder epithelium. Those larger cells you see are the bladder, they're called the umbrella cells or the superficial urothelium. And in picture B that you have there, that's a healthy cat bladder by EM. And you see the bladder's not distended, and all of the bladder cells are nicely tight together. They stay really close together. In the middle picture, it's a healthy cat bladder that's been distended under high pressure. But you can see in the IC picture that urothelium is denuded, there's abnormalities there, and the zona occludens, those are tight junctions, those are found to be reduced in bladder biopsies in IC patients. And there's also other cell differentiation markers like uroplakin and cadherin, and they're abnormally expressed. And this could indicate kind of their adaptation to the impaired bladder and an increase in permeability. And again, if you think about the urine, it can have some noxious substances, right? It's got increased potassium, increased urea, and you're going to start stimulating those nerve fibers now because they're all exposed. And again, it could result in the lower urinary signs we see. In some cats, I don't know if you've seen them, but they might excoriate all the hair in their pelvic area, or even in other places as signs of referred pain. This is some work done by Dr. Berger and her group at University of Pittsburgh. And it's been shown too in FIC cats, they might have higher endogenous and circulating serotonin. And serotonin increases will increase the non-neuronal acetylcholine release. And that leads to an increased distension-evoked ATP release. Okay? And so when ATP gets released, you're also getting release of nitric oxide from those urothelial cells, which act on bladder afferents. And then ATP sensitizes those afferent nerves. They also go back and they activate purinergic receptors. Dr. Berger has always told me that those little bladder cells are almost all like little neurons. And you get this autocrine effect, and it winds up, and it results in a dysregulated activation of all these bladder sensory nerves and pain. All right, that's all I have on the bottom up for today, so let's go top down. This I got from Dr. Buffington, and we're looking at a little bit of the psychoneuroendocrine disorders. And we all know the two basic stress response systems in the cat are the HPA axis, right, and your sympathetic nervous system. Now, you know cortisol is going to go back and shut off and have a negative feedback on the hypothalamus, but I always forget, too, that cortisol will also help inhibit some sympathetic tone in the locus ceruleus in the brainstem, which is also plays a role in this disease. So let's look at that area. This is an older study, one of the first ones Dr. Buffington did. I I was still in vet school. And if you look at this, this is looking at tyrosine hydroxylase immunoreactivity staining in the locus ceruleus of cats with FIC compared to controls. And the FIC cats had significantly increased uptake in staining compared to the controls. Now, TH is the rate-limiting step in catecholamine synthesis. So this kind of set the stage for perhaps they have an enhanced sympathetic nervous system response. So to look at this a little bit further, we evaluated kind of the stress response system in cats with FIC compared to controls. For their stress situation, what we did is for 7 days, we put the cats in a different room, we put them in metabolism cages, and we changed their food and their litter pan. So not too crazy. I think, it happens. Some of us would probably do something like that at home sometime with our cats. We also, though, took blood on those first 3 time points on the graph. And what we did, this is just an example of norepinephrine concentrations. So we found at all time points, norepinephrine was significantly elevated in the FIC cats compared to controls. Now, the last time point you see there, 15 days later, was after environmental enrichment. So this shows that environmental enrichment will help to decrease the sympathetic output, and maybe we could use this then as a form of therapeutic intervention to maybe decrease that neurogenic inflammation, if you will. And while this is just norepi, we did see increases in all the other catecholamines and many of their metabolites that we evaluated. Now, I've mentioned the locus ceruleus already. In addition to catecholamine output, it has a rich supply of alpha-2 adrenoceptors. And these receptors help decrease norepinephrine release, and they inhibit nociceptive input to the brain. And what I also think is really interesting is that the LC sits very close to Barrington's nucleus, and that is the pontine micturition center. So they're really tightly close together, which might have a role then in how this is affecting cats' urinations. So we had a hypothesis too, did it increase perhaps effect of stress on this disease, that these receptors could be desensitized. So what we did is we took 13 FIC cats and 12 healthy controls, and we gave them metdetomidine, an alpha-2 agonist. And what we found is that the healthy cats had a significantly larger pupil diameter after metdetomidine and a significantly decrease in heart rate. And those are both postsynaptic functions of alpha-2 receptors, suggesting these receptors aren't working as well, maybe again due to desensitization. Right. Then we wanted to look at the other arm of the stress response system, the HPA axis. So we took cats and we did ACTH stimulation tests on them when they were stressed. And their stress was basically they just arrived at our hospital after their owners brought them in. And then for the healthy cats, I was working with a vet student at the time when I was doing my PhD, and she would, to mimic it, she would drive them around the outer belt of Columbus and then come back in, and we did the study. So this girl is now a neurologist at Illinois, so I think that paid off in her education somewhere. What we found was actually surprising, and that the cortisol response was actually lower in the FIC cats. And we had a subset of cats that we found that we tested ACTH. They had plenty of it, but when you look at their adrenal glands, they're tiny. And there was no other abnormality in the adrenal gland. It's not like they were inflamed or had, amyloidosis or anything else. And hypocortisolism has also been reported in chronic pelvic pain, fibromyalgia, and even PTSD in humans. And so in summary, we've kind of got cats with a really altered stress response, where the SNS is really high, and yet their HPA axis is blunted. So how does that affect, and what impact did these studies have on diet and what we feed our cats with FIC? Well, the first one up at the top there, I think we're all really familiar with. We thought that, again, cats are painful in this disease, and if you dilute out the noxious substances in the urine, they might feel better. So let's feed them more water. And this study looked at 53 client-owned cats, and they were fed either dry or canned food. Now, there was a significantly lower recurrence rate on the canned diet. I think it was about 11% of the cats versus about 40% in the dry. But I think the other thing we need to think about is, did the cats just perceive this as a form of enrichment? You know, their owners are giving them a special treat. The owners loved feeding the canned food. They bonded for a bit. We lowered the sympathetic nervous system, and we helped treat them in that manner. There are other studies looking at diet and response in FIC cats. First of all, diet studies are really hard to do in FIC cats. Dr. Lappin and I were talking about this. There's so much to control, and it's hard. The one in the middle is a 1-year study. They looked at 2 different diets. The diets differed, though, in both the mineral precursors, fatty acid concentrations, and antioxidants. And they also had cats who ate wet food in both groups, so it was a little hard to tease that out. They did see a decrease in the incidence of multiple sign days in the FIC cats. So the cats had to have 2 lower urinary signs in 1 day to be a recurrence. The reason for that, though, what contributed to the difference? Was it the diet? And if so, what part? Was it the test or the control diet? And then what impact did the environment have? It is really hard to control that over a year. Just briefly to mention, too, there are, the anti-stress diets that are marketed. We have no long-term studies to really say if and how those could be beneficial then in cats with FIC. The one thing I think we do agree on a lot, though, is that particularly in blocked cats, increased moisture would be desired, because even in those plugs, we know that when cats are obstructed, the urinary pH goes up, struvite falls on a solution, they get trapped in that plug, and some of those cats have a strong crystalline component, so getting them to void more often can be very beneficial. And honestly, though, diet just needs to be tailored to the individual cat and the owner. Preferences on both sides have to be taken into account. Looking at future directions briefly just for FIC, I'll talk about the microbiome a lot more in stone disease. The microbiome in the gut is something that is starting to get looked at in IC patients and humans. And first of all, I'm really lucky that I'm able to work with Dr. Sina Marsilio. I had to get a very quick crash course on this in the past couple of weeks. And the one thing, too, is Dr. Marsilio knows I don't like to collect feces. So she will do that. And there have been, as we start to kind of investigate this further. Now, I am happy to say that we are looking at the urinary microbiome, so I'll still get the urine, Sina. But they have found some changes and associations in altered microbiome in humans with IC. We have no studies yet in cats, and it's very preliminary. Other things to look at, I'll talk briefly about epigenetics and early intervention, but I think, too, in cats, we really need improved analgesia, too. I'll just throw that out there for people working on that. Epigenetics, again, alterations in the expression of various genes that leads to an alteration in their cell phenotype without changing their genotype. That's usually done by DNA methylation or histone modification. It's a central approach to looking at this disease, and I think maybe it could be impacted by early adverse experiences. So if the mother has an adverse event and becomes stressed, the cortisol can cross the placenta, get into the fetus, and that then can lead to a predisposed cat. And so you put that predisposed cat in the provocative environment, and boom, it's got lower urinary signs. So again, optimizing the environment could be very beneficial early on in these kitties. Right. I'm going to switch gears now and talk a little bit about calcium oxalate. And this really is going to be a highlight reel of calcium oxalate. First of all, what's going on? These are some recent data from our lab at UC Davis. And what we found is from 2005 to 2018, struvite is shown in the lighter bars and calcium oxalate in the darker bars. We have seen a significant nonlinear decrease in calcium oxalate with a reciprocal increase in struvite. And this is very different from what we saw from 1985 to 2004, where calcium oxalate continued to increase. Right around 2003 and 4 at our lab, we were getting both of those stones in about the same amount. And what we found then is that trend actually continued and calcium oxalate continued to decline. Why this happened, honestly, I'm not quite sure. I will tell you that various labs are reporting the same findings, so it's not just at UC Davis. The sex predilections are essentially the same. Males slightly represented for calcium oxalate. We did find a few new breeds in calcium oxalate that were overrepresented that haven't been reported in the past. We know during this time period the diets changed a bit that we could offer to our cats. They became a little more moderate in their pH, still under the relative supersaturation for struvite, but not highly acidifying to predispose to calcium oxalate. But I also wonder, are we just surgically removing more struvite and they got submitted to our lab? And I'm not going to steal Dr. Lappin's thunder, but there's one of his studies at the bottom. Long summary, we can dissolve struvite, and we really should try diet first for suspected struvite so we can avoid cutting these cats. We can save them a lot of morbidity. All right, looking at specifically then risk factors for calcium oxalate, biggest one being hypercalciuria. This could be due to hypercalcemia, but often in humans as well, you talk about hypercalciuria being idiopathic. And that could be due to, say, intestinal hyperabsorption, increased bone turnover, or a decreased calcium reabsorption. It's probably to a combination of all of those. The other risk factors you see in yellow, I will briefly discuss. And the ones in white, other promoters and inhibitors, there's just not enough time, but realize there's a lot that goes into the risk for calcium oxalate in cats and dogs. So I have to, again, just go back a bit and talk about some hypotheses of stone formation in general. Now, the first two things you see there, the free particle model and the fixed particle model, probably have the most to do with RSS, or relative supersaturation. And in the free particle model, that implies that there's homogeneous nucleation in the lumen. So you're getting a bunch of mineral precursors, and they get stuck in that tubule, and you get a stone, okay? And then in the fixed particle model, perhaps there's some injury in the tubule. Maybe it's due to oxalate, right? It's causing inflammation in the tubule. That then makes it so that other minerals that are in higher abundance are going to stick to that area, and you're going to get a stone. The last one is probably the most common, particularly in humans, which is the formation of what's called a Randall's plaque. And what this is that crystals in the urine, they attach to crystalline deposits, and they push through that interstitium into the renal papilla. And that Randall's plaque is actually a shelf of calcium phosphate, and it provides a home for calcium oxalate to grow and develop. How then does nephrocalcinosis start to go into nephrolithiasis and Randall plaque formation? Well, the simple answer is we don't know. But this is a paper that looked at micro-CT of human kidneys to help identify what are called calcifying nanoparticles, or CNP, in the kidneys. And what they found is that the proximal tubules became very plugged with CNPs. These are about 100 to 120 nanometers in length. They're very tiny crystalline deposits. And why, again, not sure, they begin to agglutinate in that distal papillary interstitium. They break through. And if you were to scope a human kidney, you see those little black things on that renal papilla. That's the Randall's plaque, and they've removed the stone from that, okay? And that's what it looks like. Here is a micro-CT of a cat kidney. And our colleagues at UCSF did this. Dr. Larson helped collect these kidneys. And you can see here that in the blue parts that you see there in the center, those are high mineral densities, probably, again, CNP formation, that are occluding the tubules in the vasa recta. And I think the cat could be an amazing model then to help understand both the pathogenesis of calcium oxalate and maybe even the temporal development of it. And when our colleagues at UCSF showed this to their colleagues, they didn't know this was a cat kidney. They thought this could have been a human one. So as just a proof of concept study, we wanted to see if we could actually identify CNPs in cats. So we did do some healthy cats using a nanoparticle tracking analysis system to document that, yes, we can find them. So that top picture that you see there on the right shows the nanoparticles in the urine of healthy cats, again, about 100, 120 nanometers. And we know they're CNPs and calcium containing and not just urinary exosomes, because we were able to do binding studies with bisphosphonates and showed that this is true calcium. Now, in the bottom right, this is what happens when the urine sat for a while. It actually shifted from what we call the primary CNP to a secondary CNP. They became larger, as you can see, and probably less stable, and maybe more sticky. It's hard to know, but maybe this is some mechanism on how the development of the agglutination begins. And that larger graph then you see there, this is not published data. We just ran a few cats with stones and some controls. We did see higher CNPs in the patients than we did in the controls. So just an area for us to consider more research in and looking at the pathophysiology. Looking at other risk factors as well, then going back to fluid intake. Decreased fluid intake is a risk factor. Everybody should be drinking their water while they're here. And I always call out Dr. Quimby. That woman does not drink water and she knows it, and I tell her she has to. Thank you. What they did, I pulled at this paper in humans on, you're right. And I like this because they did micro CT on humans who were either told to drink a bunch of water or those who were not told to do so after they had stones. And they found that in their renal papillary portion, there was a decrease in the mineralization if they drank their water. Kind of an elegant study to say, hey, this is pretty free and it doesn't have side effects, so do it. And certainly there's lots of things to look at increasing water intake in cats if they won't eat a canned diet. There's some nutrient-enriched waters. There's also studies looking at increased viscosity water intake. I think they had a 1% methylose water, which increased that viscosity, and then the cats had a significantly lower urinary specific gravity. So other things to consider that may be helpful in preventing calcium oxalate. pH. When I was in school, I was always taught we got to elevate that urinary pH, get them on those alkalinizing agents because that'll prevent calcium oxalate recurrence. Well, I think over time we've learned that probably not as important as we once thought. Calcium oxalate can occur over a wide variety of urinary pHs. And I think it's much more important to decrease that specific gravity than it is to put them on a bunch of alkalinizing agents. And I just picked one study here. These were 13 cats. It is a short-term study. It was 7 to 9 days, I think, adaptation with about 3 to 5 days of urine collection. The diets they fed them either produced a urinary pH that ranged from around 5.9 up to maybe 6.4. Not surprisingly, the relative supersaturation for struvite went down with lower urinary pH. Now, calcium, both the excretion and the concentration increased with lowering urinary pH, but the oxalate excretion and concentration went down with the decreasing pH. And so overall, there was no change for calcium oxalate RSS, depending on what pH was there. So while pH might have some influence, it's probably pretty mild. And in other studies, it was shown that influence was minimal, and likely if the pH was, I think, greater than 7.2 or maybe less than 6.5. In humans, protein is considered, on high protein intake, is a risk factor for urolithiasis. Older epidemiologic studies in cats have suggested it might actually be a little beneficial, maybe because they drank more water associated with the increased protein. But what I think we have learned as well is that both, not just the protein intake, but the protein type can have an impact on calcium oxalate. And it's been shown that substantial amounts of glyoxylate and oxalate are synthesized endogenously through the metabolism of hydroxyproline. And this study at the bottom there looked at different hydroxyproline concentrations that were fed to cats. And what they found is that hydroxyproline intake, the higher hydroxyproline diet, increased urinary oxalate even when they were fed a low oxalate diet. Suggesting, again, I think it's something we need to look at in the diets, not just the quantity, but of course the type and quality of protein. Another area I think that's a little bit kind of in the future directions a bit still are trace element analyses. And we did this study, actually, these are canine dog stones, and we looked at calcium oxalate canine stones, and on the bottom are all the trace elements. And you can see, a wide variety of detection. And the lighter bars behind that, those are human stones. Again, showing a fair overlap in trace elements that are seen in these stones from both species. I just picked one paper that looked at, again, some diets, they do look at the evaluation of some of these ultra trace minerals. Now, they didn't look at the bioavailability of them in this study. They thought, okay, the levels are likely still, though, safe for most pets. I always have to think, though, well, what's the genetic predisposition? Are there some that are going to be a little more sensitive to that, maybe that copper or that zinc or other elements that have been shown to be much more lithogenic? And also, I have to keep in mind, right, we've got a lot of clients who, I hate getting this, I'm sure you do too. I'm not feeding my dog or cat that kibble, that's garbage. And they think it's poison, I get that too. And they want to feed these boutique diets or these home-cooked diets, and we don't know what's going on with a lot of those. And also, what environment are they in? So I think these are good discussions we can have with our clients and why recommending studied diets can be much more beneficial for their pet. Back to obesity. We're all going to be fit and trim after this when we start thinking about all the risk factors obesity leads to even in our pets. An increase in BMI has been positively associated with the risk of nephrolithiasis in humans, likely due to what they call a carbohydrate-induced calciuria. The middle paper shows these were questionnaires from vets who submitted stones to this laboratory. They had over about 7,500 canine and feline stones, and the vet could check if the animal was either overweight or obese. And so it's very subjective. They didn't have BCS, but over 42% checked that they thought the animals were overweight or obese. Oh, that was pretty impressive. The bottom study is in dogs, and they looked at the mean body condition score and found that it was significantly higher in calcium oxalate compared to controls, but they did state neither of them were obese. But I think it's a good launching point to have this discussion and further research. Back to the microbiome. So it is definitely an emerging area in that gut-kidney axis. And again, bacteria can affect the composition of the gut microbiota, and it's involved in various different kinds of renal stone formation. We know that, for example, dysbiosis, right, associated with struvite, right? Staphylococcus, a urease-producing bacteria, will cause struvite stones. But there's also some bacteria that if you don't have enough of them, can predispose to calcium oxalate. And the one that's been studied initially and for years is oxalobacter. It was even studied in dogs, and dogs that had a decrease in oxalobacter had an increased risk of calcium oxalate. But patients could also form stones despite having plenty of oxalobacter. And also, oxalobacter requires a host of a variety of other bacteria to help keep its colonization going. So I think, yes, the gut microbiome could influence calcium stone formation, but it goes way beyond just oxalobacter. If we needed another reason to have antimicrobial stewardship, here's another one. There are increased rates of antibiotic use in human stone patients. And in this paper here, they evaluated genetic hypercalciuric rats. They fed them the same diet, so they were able to control for that, and then they gave them either ciprofloxacin or TMS. And they found that the gut microbiome was definitely a factor in urine chemistry, saturation, and stone risk. And antibiotics, particularly in this study, it was Cipro, altered the microbiome, particularly lowering bacteria that could degrade oxalate. So we also, as it was mentioned the other day, keep this in mind when we're doing microbiome studies. We do need to make sure they're off antibiotics for a minimum of 2 to 3 weeks. But I'm very happy too, we are looking at the urinary microbiome. And I just pulled a few papers. The top one I pulled primarily because they did look at humans and they looked at the urine collected from the renal pelvis. And they did it from the kidney that had a stone and the kidney that didn't have a stone. And they found that the kidney with a stone had a higher prevalence of the Corynebacterium species. They weren't quite sure what to do with that information, but what I liked is that they also said, hey, you probably don't need to collect the urine from the pelvis because it's also really similar to what's going on in the bladder. And then the middle paper there is actually a paper that came out of Minnesota recently, and they looked at 9 stone formers and 10 control miniature schnauzers. And they did the urogenital microbiome, so it was a free catch sample. They didn't find any significant differences between the groups, but when they went back and looked at things, they were just starting to see that maybe Acinetobacter was increased in the stone formers, and that has also been found in humans with calcium oxalate stone formation. Finally, the bottom paper there, this did look at cats, and they looked at cats with, I think they had 14 controls, 17 with chronic kidney disease, 9 FIC cats, and 8 cats with positive urine cultures. They did find in the CKD cats that Escherichia shigella was the predominant type. In the FIC cats, they had no dysbiosis noted, but again, this was only 9 cats, and they give that as a caveat. So again, just preliminary data as people are starting to investigate this area of research. So one consideration that was brought up in the talk this afternoon, which was so nice to see too, is that all of these studies that are looking at the microbiome are using the 16S RNA gene. And this is great because it is cheaper, right? And that has to go into our studies, right? We have to look at our budget. It allows detection of the genus level, but we might need more expanded quantitative urine cultures as well as that multi-omics approach to look at both DNA and mRNA so we can see not just what these strains are there, but are they alive and what the heck are they doing? Because that's going to be where we head toward and it's going to give us the most information. So it leads to just a few metabolomic studies here. The one that you see there in cats was 25 controls and 16 CKD cats and 6 FIC. They documented over 9,000 metabolites. And then they said maybe about more than 1,000 they would say, okay, I got high confidence in this. They didn't find any difference in the metabolome profiles between any of the groups of diseases, but they did find that diet type, and it was dry food, had a specific metabolome profile. So again, kind of a launching preliminary study and stuff, a launching pad from where to go. The other study was done in humans, and they had 15 urinary stone formers and 12 controls. They actually found that these stone formers did have a unique metabolic abnormality, and they had a decrease in alanine and tryptophan as 2 examples, and those are also really needed as inhibitory effects on crystal stone formation. And they said this could be strongly influenced by diet and also the lifestyle of the human. And maybe these are going to be a little bit better at predicting lithogenicity than kind of some of the what we have to work with at this point. So there's lots that I think goes into the propensity for these little nanoparticles to aggregate and make those stones. Just a very brief slide on genetics. Again, well out of my bandwidth, but I think there's lots of studies in humans looking at the fact that calcium oxalate can be heritable. There are some gene mutations and deficiencies primarily associated with the inactivation of vitamin D that can lead to hypercalcemia and or hypercalciuria, and other mutations that deal with oxalate transport. There's some early evidence in cats suggesting too that maybe for some heritability in hypercalciuria as well as hyperoxaluria. I'm just going to leave that there, and I'm going to let the geneticists do their thing. But the one thing this lets me know is when I am doing studies, I am definitely banking all my samples, because these are things I think as we start to pool our resources, this is where we're going to gain a lot more powerful information. I'm also talking about stone disease and stress. I said in all my lower urinary tract cats, I get an environmental history. Looking at animal models, it has been shown that their litholytic urinary constituents actually decrease under stress. And in human studies, looking at 24-hour urine excretions, their lithogenic constituents could peak within 24 hours after a stressful life event. And those were such substances like calcium, oxalate, and uric acid excretion. So I do think, it's not going to hurt. We can certainly use a lot of the tools that we've learned about optimizing the environment for our stone patients as well. And I think Dr. Quimby and I were talking for our CKD patients too. Now, this last slide I took from Dr. Buffington just to kind of summarize it. I think it puts it well, a good model of FLUTD that brings kind of it all together. He always says we're evolutionary beings, right? The cats have evolved over time. And then you've got some genetic predisposition, however that might have occurred, to develop specific diseases. And then, of course, there's all these epigenetic effects that could be, too, from the environment, the diet, what that diet has on your microbiome, whether that be the gut or the urinary. And hopefully you're teetering, you're doing okay. But then maybe you have some big stressful life event, or even that cat perceives it as stressful. And if it doesn't immediately go to recovery, you could end up, depending on your genetics, right, developing FIC, developing a stone, or any other of those comorbidities that we do see in cats with FIC as well. So the way I like to look at it, if I can get back in the pathway to hopefully prevent it from starting, it's going to be optimal. And then we also need to work, too, on treatments for if the cats develop these diseases, too. So we're kind of on both sides of those arrows at this point. And with that, that's my overview, and I will be happy to take questions and comments during the session this afternoon.